Now at 6, a News 5 investigation. More children taking their own lives.
Kids my age or younger need help, and we need to get them help.
They're living with unprecedented levels of anxiety and depression.
It is just way harder to be a kid and way harder to be a family.
Now we know the pandemic has had a severe impact on children's mental health. So what's being done to help them? Good evening and thanks for being with us at 6. I'm Courtney Gooseman.
And I'm Rob Powers. Tonight, our investigation, Unstable, reveals how we are failing kids in crisis. News 5 investigator Sarah Butteson's here now. Sarah, you found an alarming trend here.
We did, Rob and Courtney. It is secret. Mental health workers are in short supply right now. The result, children are unable to access help they need in even the most critical situations.
Children have vivid imaginations. But even as a little girl, Latavia Cloud knew.
I was maybe 10 or 11.
Her mind,
Hearing things and seeing things that aren't there.
was different.
And the voices tell me to hurt myself sometimes.
Her diagnosis, devastating. Schizoaffective disorder, a mental illness that can be treated but not cured.
It crushed me because I was like, I don't want to live this way.
Her thoughts grew darker, so dark. She needed what's known as a crisis bed, inpatient care for people in immediate danger of harming themselves or others.
I feel like it was very important because if I didn't, I might not be here today.
But we found kids in crisis are often unable to get help.
What we're finding is those beds can't be filled all the time.
Scott Osicki is the Chief Executive Officer of the Adams Board of Cuyahoga County.
We have the beds available, but we don't necessarily have the staff to provide the needed care to the individuals in that crisis bed.
The result? During the pandemic, records show more than 100 teens waitlisted for crisis beds just in Cuyahoga County.
We know that there are children in need, right? So it was really disappointing to find out that there's not enough staff now in order to provide the services.
Every day we are getting calls from families in crisis.
Jeffrey Locks is the Executive Director of Belfair JCB. The nonprofit provides behavioral health services for children, including crisis beds.
It's heartbreaking when we're saying to people, we'd love to help, but we've got a wait list.
Because Belfair has operated with just 60% of its staff since the pandemic started. The only 2 other agencies that provide crisis beds for kids are also short-staffed. We found Applewood Centers needs 20 workers. Ohio Guidestone, 28.
We get a word that I cannot believe I say at this age, ghosted.
He says job candidates don't always show up or even call to cancel.
We get ghosted on a percentage of interviews that would blow your mind.
So does where workers go. Industry pay remains low, so he's competing with businesses like Taco Bell, Dairy Queen, and Mitchell's Ice Cream.
They're offering way more than we offer per hour, plus college tuition, plus all the ice cream you can eat. I literally can't compete.
Even more troubling, the pandemic didn't only spark the Great Resignation. The Centers for Disease Control and Prevention found almost half of high school students reported persistent feelings of sadness or hopelessness. Suicide rates increased in 6 states and here in Cuyahoga County. We found 17 people under the age of 25 took their lives just last year.
I feel like we need to do better.
Latavia used a crisis bed again and again as she learned to cope with her illness.
I just didn't want to live that life of sadness, of being scared all the time.
She's not. Now 20, she's an active member of Magnolia Clubhouse, which serves people with mental illness. In college, living, her light drowning the dark voices inside.
I want to have a life, a happy one.
So what's the solution to the worker shortage? Here in Cuyahoga County, the Adams Board has given $1.7 million to facilities to help retain and recruit staff. And statewide, Governor Mike DeWine recently introduced an $85 million plan to grow Ohio's behavioral health workforce. I'm News 5 investigator Sarah Buttison.
Sarah, we appreciate you letting us know about this very important issue. Thanks so much. There's also a new resource for kids and adults experiencing a mental health crisis. You can now call or text the number 988 from anywhere in the U.S. It's a model after the 911 system, and that number is designed to be a quick way to connect people to mental health help.